opportunity for everyone to serve the humanity, to serve the underprivileged, to serve the suffering. So it's very important. Apart from our skills, we need to also focus on our emphasis on our communicating skill as well, and being very empathic towards our patients. This is also very important, where our graduates and diploma holders who are coming out of the university should inculcate, and also the university should be guiding force in this. Saying these words, I thank all the officials of the university for having given me an opportunity to be a part of this function. Thank you.
ಆರೋಗ್ಯ ವಿಜ್ಞಾನಗಳ ವಿಶ್ವವಿದ್ಯಾಲಯ ಬೇಕು ಎನ್ನುವ ಹೋರಾಟದಲ್ಲಿ ತನ್ನನ್ನು ತಾನು ತೊಡಗಿಸಿಕೊಂಡು ರಾಜೀವ್ ಗಾಂಧಿ ಆರೋಗ್ಯ ವಿಶ್ವವಿದ್ಯಾಲಯದಲ್ಲಿ 5 ಬಾರಿ ಚುನಾಯಿತ ಸೆನೆಟ್ ಸದಸ್ಯರಾಗಿ, 4 ಬಾರಿ ಸಿಂಡಿಕೇಟ್ ಸದಸ್ಯರಾಗಿ, ವಿದ್ಯಾರ್ಥಿ ದಶೆಯಲ್ಲಿ ಮೈಸೂರು ವೈದ್ಯಕೀಯ ಮಹಾವಿದ್ಯಾಲಯದಲ್ಲಿ ವಿದ್ಯಾರ್ಥಿ ನಾಯಕನಾಗಿ, ಕುಲಪತಿಯಾಗಿ ಅಧಿಕಾರವನ್ನು ಸ್ವೀಕರಿಸಿರುವಂತಹ ಗೌರವಿತ ಕುಲಪತಿಗಳಾದ ಡಾಕ್ಟರ್ B.C. ಭಗವಾನ್ರಿಂದ ಅಧ್ಯಕ್ಷೀಯ ಭಾಷಣ.
Respected Dr. Sharan Prakash R. Patil, Honorable Minister for Medical Education and Skill Development, Government of Karnataka, and Pro-Chancellor of Rajiv Gandhi University of Health Sciences, Karnataka, who inaugurated this Foundation Day, 30th Foundation Day. Your advice and suggestions have been well taken, sir, and we'll try to implement and make the university progress in the right path. He is known for his simplicity, and at the same time he's been very, very concerned about the quality of education that's being given in our state, and also about the patient care. Very honored and privileged to work with Shri Sharan Prakash sir. Respected Avadhuta Shri Vinay Guruji, he is a spiritual leader and thinker who is guiding this state and the country, especially for the youth, with his good messages and with his deed, which is the need of the hour for all the youngsters of this country. He is with us today to deliver the endowment lecture on the topic lifestyle management and the spiritual thinking. And we are honored to have you here, sir. Respected Dr. Gauri Rokkam, holistic nutritionist, yoga, nature cure therapist, who will deliver the endowment lecture on the topic food and nutrition. Our beloved and respected Dr. Kanta Jadhav, who was my mentor and guide also, and my teacher from the day one at Mysore College. She should have been here. She is the first Vice Chancellor. Unfortunately, she is not well. So her son, Dr. Santosh, who was my college mate, is here. He is a radiologist. Dr. Ravindra Saudi, again, another friend of mine, who is representing late former Medical Education Director, Shivatna Saudi, who is also here. Former Vice Chancellors who have guided this university, brought this university to this level. Former registrars, head of the academic bodies, Senate and Syndicate, members, boards of studies, my colleague Sri Shiv Prasad, Riaz Basha, registrars, Gangadhar, finance officer, and all the students, our employees, media persons, ladies and gentlemen. On the auspicious occasion of this Foundation Day of Rajiv Gandhi University of Health Sciences, Karnataka, I extend my heartfelt greetings to all the students, faculty members, affiliated institution staff, and the stakeholders who have contributed to the growth and excellence of our esteemed university. From a fledgling university of about 200 colleges at its inception, we have now grown to more than 1,400 affiliated institutions, making us the largest global network of health sciences education provider, as our Honorable Minister put it. In this journey, we have established our credentials as a preferred destination of health professionals, education and research. As we celebrate this significant milestone, it's my privilege to announce the following programs, key initiatives and developments aimed at strengthening our academic, social and infrastructural ecosystem and reinforcing the existing programs. We have launched drug-free, tobacco-free and plastic-free, a transformative policy initiative. In pursuit of a healthier and more responsible academic environment, RGUHS is launching a university-wide campaign and across all affiliated institutions to promote drug-free, tobacco-free and as much as possible plastic-free as an initiative. This campaign strengthens our commitment to sustainable development goals and paves the way towards achieving universal health coverage. It's very disturbing that you would have all read today is the anti-drug day, but that most of the studies says the healthcare workers and the students involved in some kind of a drug abuse is increasing. It's almost about 25 to 30%. It's alarming and very disturbing. So Rajiv Gandhi University wants to make and declare all the campuses tobacco-free, drug-free, and also it's an initiative from our colleagues at Surgical Society that we make all the institutions and the hospital as much as possible plastic-free. Introduction of new fellowship courses and academic programs. As part of our commitment to advanced learning, research and capacity building, we are launching the fellowship courses in various interdisciplinary areas. We are also starting MSc in Forensic Science, Nursing and Nurse Practitioner program in specialties as approved by the Indian Nursing Council. In addition, we are introducing 2 academic degree programs, MSc in Biostatistics and BSc in Nuclear Medicine Technology, and many other allied and nursing courses. Divine Mother and Child Health Program, recognizing the crucial role of rural and peripheral health services in achieving equitable health care across India. We will be strengthening the Divine Mother and Child Program. This is a comprehensive health initiative focused on the well-being of mothers and children and provides hands-on training and exposure to health education, preventive screening and public health awareness. This initiative has involved MBBS interns and postgraduate students from 13 leading medical colleges based in Bengaluru. A detailed outcome and impact report are prepared and submitted by Sri Madhusudan Sai Institute of Medical Sciences and Research Center. Strengthening our RATI, which is our Academic and Administrative Training Institute, to enhance academic training, skill development and interdisciplinary research for faculty and students. Key initiatives include launch of Network of Faculty Training, NEFT, which is decentralized faculty development network with regional hubs to promote mentorship, localized training and peer learning and upgrading to advanced courses in educational methodology. Empowering the future, we intend to launch RGUHS Centralized Placement Cell. RGUHS proudly announces the launch of a centralized placement cell to bridge academic excellence with career opportunities, empowering students to become job-ready healthcare professionals. The placement cell will actively coordinate and collaborate with the alumni network to expand the scope and reach of information. This cell will have many verticals. One is the organized, structured placement drives, skill enhancement programs, internships and personalized career support. This will also be a repository of information about all the courses available across the globe, which we did not have. Establish a finishing school to provide industry-relevant training, career counseling, and real-world exposure through projects and internships. Devise a strategic ecosystem to collaborate with hospitals, research centers, and corporate for job creation and innovation. Put in place Language and Communication Lab, which is one of our dream projects of our Honorable Minister. He has already given a press statement and he is working on that. And we intend to start that Language and Communication Lab for foreign language training, digital resources, regional language support, and language cells across the institutions. This will enable all our students to appear for jobs and other future programs across the globe. Research and development activities at RGUHS and tripartite MOU for the research and innovation. Our university is strengthening its focus on research-driven innovation and academic excellence. Currently, over 250 research scholars are pursuing doctoral research across affiliated institutions. The university supports research through 4 major grant schemes with an annual allocation exceeding 5 crores. This includes undergraduate research grant encourage early research exposure, faculty research grant for independent research initiatives, collaborative research grant for multi-institutional research projects, and thematic research grant for cancer research on oncoepidemiology. Just now when Guruji entered, he advised me that cancer research should be the centric one and we should concentrate on that. Even our Honorable Chief Minister of Karnataka has suggested us that we do more research toward the oncology. Additionally, the university is launching an incubation cell and advanced research center equipped with state-of-the-art facilities scheduled to be established this year in the university's research camp, which is coming at Bhimankuppe, Bengaluru. Rajiv Gandhi University of Health Sciences, in its continued pursuit of interdisciplinary collaboration, is signing a tripartite memorandum of understanding with VTU and Sri Madhusudan Sai Institute of Medical Sciences and Research Center at Chikballapura to foster research, innovation and interdisciplinary collaboration in the field of health sciences, engineering and technology, which is the need of the hour. Strengthening academic outreach and health awareness through Prasaranga. The Prasaranga department is actively contributing for the academic, cultural and public outreach efforts of the university's commitment to knowledge dissemination and health literacy through its literature and production of books, printing and production of books. We are in the process of designing brochures, coffee table book and updating the university website. To enrich in its activities, we have formed an advisory committee consisting of eminent personalities from across the section of literature's domain. Establishment of skill labs at various locations across the state. Our university is establishing state-of-the-art skill labs to enhance hands-on clinical training and simulation-based learning for students across health sciences discipline. To begin with, these will be located at the university's academic and research campus at Bhimankuppe in Bengaluru, and then at regional centers at Kalburgi, Belgavi, Davangere, Mangaluru, Hubli and Mysuru. This facility will serve as a centralized training hub for competency development, promoting patient safety, clinical excellence and practical proficiency in alignment with global medical education standards. Establishment of colleges, RGUHS colleges. We intend to start new colleges in allied sciences and nursing education across the state in the regional centers. Helinet. The university is pleased to announce the launch of a Bachelor of Science (BSc) in Electronic Health Records and MSc programs in Health Informatics under the aegis of Helinet, department of our university. This pioneering program is designed to equip students with interdisciplinary skills in healthcare, information technology and data management, addressing the growing demand for trained professionals in digital health system and medical informatics. Along with these academic initiatives, RGUHS is also establishing a dedicated health informatics center to facilitate research and innovation in health information system, support digital transformation in healthcare delivery and education, and serve as a knowledge hub for electronic health records, telemedicine, and data analytics. Additionally, we are creating a resource for PG NEET examination, content generation, which is not there and which is sold at a very high price by the private organizations, and authentication for teaching and learning materials, smart classrooms, digitalization of the AYUSH print literature, which is not there at present. No print available of any of the literatures of the AYUSH department, and we would like to do that through our LNet consortium. Digitalization of and also co-publishing RGUHS journals with internationally acclaimed quality journals. To conduct series of training on how to write scientific articles and publish international journals, we are conducting workshops regularly. All India Health Sciences Universities Conclave, a strategic leadership meet. This conclave aims to foster a collective vision for excellence in health sciences education, ensuring standardization, transparency, and future readiness in university evaluation mechanisms. Operationalization of RGUHS administrative block at Ramnagaram. Our Honorable Minister just now reviewed it. The university's permanent campus at Ramnagaram is nearing completion and will soon be ready to accommodate and commence our operations. In a sprawling 216 acres campus, the state-of-the-art university building is coming up. As part of this transition, the university's administrative block will be relocated to Ramnagaram campus, making a major milestone in RGUHS long-term vision for institutional consolidation and growth. A master plan is being made to have colleges, hospital, water bodies, and green spaces. We acknowledge and request the facilitation of the transfer of 180 acres of land which has been registered under DME to be transferred to Rajiv Gandhi University of Health Sciences. We request our Honorable Minister to do that. As part of the administrative reforms, the university is pleased to announce that the process of preparing a comprehensive financial statute to strengthen the financial management and administrative governance of the university is underway. This initiative reflects RGUHS' commitment to financial discipline, institutional transparency, and good governance. We earnestly appeal to the Government of Karnataka to consider and approve necessary amendments to RGUHS Act to empower the university to operate with greater academic autonomy and administrative efficacy. We humbly request our Minister for Medical Education to approve the recruitment of additional academic and administrative staff at Rajiv Gandhi University of Health Sciences, since it's growing and we almost have 1,450 institutions, and it's very difficult to manage with the present staff. Welfare measures for the employees. As part of the welfare, the university plans to establish a housing society for RGUHS employees to support their long-term residential needs and security. The university is committed to well-being and welfare of its employees. As part of its ongoing employee support initiative, university has made provision for comprehensive health insurance coverage for all the employees. And in conclusion, let's move forward together with renewed dedication and purpose as we honor the legacy of this institution and strive for excellence in health sciences education, research, and service. I thank all our former Vice Chancellor, registrars, and the employees and all my colleagues, officers, for guiding this university to a greater height, and their presence today means a lot for all of us, and we look forward to continued support from them. Coming together is a beginning, keeping together is progress, and working together is success. If you are walking down the right path and we are willing to keep walking, you will eventually make progress. Thank you very much for supporting Rajiv Gandhi University of Health Sciences. Jai Hind, Jai Karnataka.
ಒಳಗಡೆ